I'm John Kaiser. I'm on the insurance committee as well as the board. And once again, we'd like to open the meeting with the couple of consultants that are here today. The open enrollment period for Advantage plans and Part D plans is October 15th to December 7th. That's why we try to get together at this time. We have two of our consultants here today. We have Ericka Mann with Butler Capital Advisors, and David, as well as David Baum's here, who's the manager as well. And then also we have David Key from Double Health USA. Not here today is Via Benefits. They have some brochures here. And also we have a new consultant that you'll find on our website, which is Go Medigap. We have some business cards for them. All of our consultants have their presentations on our website. So if you want more information, you can always refer to the website. But without further ado, I'm going to let them come up and speak, and then open up to Q&A, and of course they're available afterwards. So I'll start by asking Ericka Mann from Butler Capital Advisors to come up.
Do I have a clicker? Is there a?
Big white button.
Thank you. Good afternoon. I see a couple of new faces. Is anybody in here new to this whole Medicare process, the open enrollment? Not to single you out, but I just want to make sure, because there's a lot of familiar faces and a couple new. So as John said, this is the time of year. This is the Medicare open enrollment period, which started October 15th, so just Monday. Everybody that is currently on Medicare has from now until December 7th to review your plan options if you're on a Medicare prescription drug plan or a Medicare Advantage plan. Now is the time for you to look at your plan options and make sure that you're on the best plan for you for the upcoming plan year for 2019. I'm from Butler Capital Advisors, and we are an independent insurance agency located in Perrysburg, Ohio. So don't be deterred by the fact that we're in Ohio. We're still pretty local, and we've been in business since 1997. We specialize in financial planning, group and individual insurance benefits. And today we're here representing ourselves as Medicare consultants for you. I mentioned a little bit about what we do. I have a very short amount of time, I believe, so I'm going to go through this quickly. The reason why we're here today is because we represent a lot of Medicare supplement plans, Medigap, prescription drug, and Medicare Advantage carriers. So as an independent agency, we are able to take a look at all of the Medicare plan options that are available to you, that are out there. And there are about 30 prescription drug plans you can look at in the state of Michigan. So we can help represent pretty much all of those and help you really compare the best plan options for you and help you make a decision as to what's the best Medicare plan for you for 2019. Just a picture of our building. Little advertisement. You can, if you want to check us out a little more, we do have a website, butlercapitaladvisors.com, just to get a little feel about who we are and the staff that work there and what we do. So today, why use an agency? Why use Butler Capital Advisors to help with your Medicare options? There are a couple of different routes that you can go and use when you're looking at your Medicare plans. You can go directly to the insurance company and enroll directly with them if you're interested in a Medicare plan, or you can use an agency like us. And as I mentioned, we're a local agency for the most part. Our staff have over 30 years of experience in the Medicare market, so a lot of experience with different situations, different enrollment rules, different concerns. We can help with your billing issues. So once you enroll in a Medicare plan through us and allow us to be the agent on your policy, we do help you with any billing concerns, billing issues, claim issues. We help you with enrollment in the plans and any cancellations if you want to terminate your coverage. We do most of our communication through email over the phone, and of course personal face-to-face appointments. We have had quite a few people that live in this area drive down to Perrysburg, maybe just an excuse to go out to lunch or something like that. But most of our communication for those that are outside of the Ohio area are through email and phone, and it works great. We can help you with your HRA reimbursements from WageWorks, which I know can be very confusing. So we do try to help as much as possible, if you'd like, with your reimbursement accounts. And we do an annual review of your Medicare coverages every year. So if you enroll through us or let us help you enroll in your policies, every year you'll be contacted by us to say it's that time of the year again. If you want us to help you look at your policies, which we are in that time of the year, we can do that with you year after year. So it's not just one and done. We are here to help you going forward with maintaining the best plan for you and looking at your coverage options. And the best part is there's no fee for our services. So we're here to help you review your plan options, make a plan choice, and we just ask that if you do that, if you'd like a plan that we're showing you, that you allow us to be the agent on your policy, because that is how we get paid. We get paid from the insurance companies, a certain commission amount. But there's no upfront fee for you to use our services. The way we typically start, whether you're a new client turning 65 and just starting on Medicare, or it's the annual review time, we ask you to fill out just a one-page questionnaire that asks simple things like what's your zip code, your date of birth, your Medicare effective dates, and most importantly, what are the medications that you're taking. At this time of the year, when you're reviewing your drug plan options, it's most important to know what prescriptions you're taking because every Medicare plan covers your prescriptions a little differently. So we ask you to fill out this form and get it back to us, and we use this to run multiple plan options with what's available to you. Again, as an independent agency, we represent a number of insurance companies. These are just some of them listed here, some of the big ones: Aetna, AARP, United Healthcare, Transamerica, Humana, SilverScript. So we really do try to look at the whole gauntlet of options for you and really make the best choice based on your coverage needs and your budget. I'm going to flip through some of these because they're not all pertinent. Here. Oops. Also, we have some information over at our table, along with those Medicare questionnaire forms. We do have information about group dental and vision plans that we offer to retirees. Medicare doesn't cover dental or vision traditionally as far as glasses, contacts, or dental work. You do have some individual options out there, and I believe you still have an option through Chrysler with Delta Dental. These are just two more options: VSP Vision Plan and a Guardian Dental Plan. And again, we have information over on the table if you're interested in looking into that. We're here today to help answer any questions that you have. Again, this was pretty quick, so I'm just flying through that. But the biggest thing I want you to take away today is we're an agency that's here to really help you look at what are your needs, what type of coverage do you need, what are the plans that you have now, and are you looking to switch? We're here really to just try to help you make the best decision for you, a family member, your spouse, and to help serve you going forward. So we're here not only at the annual Medicare open enrollment period, but also throughout the year. We work with a lot of retirees as they're first turning 65, whether it's for themselves or their spouse, or even family members, to help them make plan choices when they're first joining Medicare, and then also every year going forward during the annual review. Okay, and I think we'll probably do questions afterwards, or?
Yeah, let's not on that specific question right now.
Okay. Okay. Thank you.
Okay, thank you.
Thanks, Erica. I can clarify on the Delta Dental. It's a program that it's not really brought to us by FCA. It's just available. Delta Dental has an individual policy entity, and they have a different level of maximums, annual maximums, that you could sign up for. That doesn't mean it's better or worse than what is offered here, but it isn't literally offered by FCA.
Yours is Delta, though.
Pardon? Yeah.
No, is yours Delta?
But the particular one I'm talking about is different than on your schematic, as I understand it.
We have the Guardian plan.
A Guardian, yeah, with Guardian, and anyhow, that's just clarification on on the Delta question.
Delta's not open this year, right?
If you're under 65, right? Anybody, a couple here under 65? Good. You'll join us someday. Anyhow, this is a closed year for vision and for dental going to 2019. That's what they call it, a closed year. You can't cancel that coverage. You have to keep it if you have it, or you can't sign up for it if you hadn't signed up for it before. Okay. John, handle it. Go for it.
I'll just hand this to Dave.
Yeah, we'll give it a minute. Thank you.
I'm glad Dave moved that glass. I wonder how long before we're gonna knock it over. Next, I'd like to introduce David Key. David Key is another long-standing consultant that done a great job for us, just like Butler Capital Advisors. Would David like to come up?
Good afternoon, everybody. Good afternoon. Let's see, let me just switch this. There you go. David. Right there in front. Oh, right in front. Oh, there it is. Okay, thank you. My name is David Key. I've been working with Kaiser now for, I guess, 35 years. Actually, my experience was with Blue Cross Blue Shield of Michigan, where I had responsibility for the Kaiser account, and so we worked about 22 years at that. And since that, when I retired, I decided I wanted to keep going on something, so I decided to continue to help with retirees. We were involved with Kaiser when they made all the changes, so we've been pretty familiar with all the changes that Kaiser has had. So that's kind of my experience. And the company that we formed is called Double Health USA. And our philosophy is kind of a relational rather than transactional process. Like Ericka and Butler Capital, we are an independent agent, so we represent a number of different insurance companies. And what we try to do with that is to try to look at things not from a one and done, but a relationship. And our kind of philosophy is we want to understand the environment, understand the products that are available, understand the client, and try to educate the client so that you can make your own decisions. Because what I may think is best may not always be the best, because everybody thinks a little differently. And so we work with the clients to bring out the best choices for them. And we also have a little philosophy. We always assume a Murphy's Law philosophy that if something's going to go wrong, it probably will. So even though it's not, even though it would be a small percentage, we try to build into things in our process so that we're able to anticipate that. So if you have a problem, that we can go back and correct it. Well, we mentioned that we're an independent agency, and we're located in Michigan. Our offices are in Novi. We're appointed with a number of insurance companies, both nationally and in Michigan, licensed in 33 states, and again, have been around for a little bit in the insurance industry. There are I want to give kind of 4 examples of how this philosophy works, and it's we're looking at Medicare plans, changing plans, prescription drug plans, and dental insurance. Excuse me. As far as Medicare plans, some of the things we do, excuse me, we like to have try to give you a basic understanding of what plans are about. And we actually have a presentation we put up. We found that the best ways to do that is by looking at 12 questions that you should know. And if you know the answers to these 12 questions, you probably get a pretty good idea of which way of what Medicare is. And we're actually having a webinar on this on the 23rd of October, which I think all of you have gotten notice of. And that's kind of what we do with that. Now, we also want to try to understand what your needs are. Thank you, Rich. Thank you. Another glass of water will knock us down. And there are different products, and there are different approaches, and companies are not always the same. We help you complete the application process. We even help you with Medicare, try to figure out how that works for you and what you have to do. We can't apply for you, but we can certainly guide you. And then we troubleshoot as if problems do end up occurring. The 12 questions, we won't go through these in detail, but just what they are is like we have what is Medicare, and that gives some general description. Then we go through the three kind of basic choices that probably 90% of people will make, and that'll be original Medicare with a drug program, original Medicare with a drug program, and a supplemental or Medigap plan, or Medicare Advantage plan. We also can help with changing your Medicare plan. There are kind of pros and cons issues with each kind of plan. If you change plans, certain plans, you have to have things about medical underwriting that you need to look at. Because once you make a decision, that's why your first decision is important, because it's not always easy to make this the second time around. You have different bars and barriers you have, especially an insurance company doesn't necessarily have to accept you unless it's a Medicare Advantage program. So with that, we're looking at the different application processes and then comparing your existing plan with alternative plans and kind of trying to make sure it all fits in an open enrollment period. So that's kind of how we work with changing your Medigap plans. To be frank with you, I think that for the most, or Medicare plans, for the most part, I think you should have a pretty good reason why you want to change plans for that. So we think it's important that you don't just change this for the heck of it, but you really have a very good reason for it to help you. We look at just prescription drugs. How we work with that is we kind of have an really kind of redundant process, but we actually look at every drug that you have, and we actually check it out with formularies for at least 3 or 4 largest companies to make sure that that drug is on that formulary for that date in case we ever have a problem for that. And then also what the price is that you pay. So it's kind of a tedious process, but on a few occasions we've had to use that where we had to go back and say, wait a minute, this is covered, here it is, and find out what the issue is. So and that's that's something you need to look at. Formularies are important because they could change. So as Ericka said, I think it's very good to at least check to make sure at least your high-cost drugs are still covered. And of course, we go through any kind of enrollment or troubleshooting. Dental insurance is kind of a similar process. We look at, we try to get an idea of what your needs are, because the dental plans are different when you retire. They usually have smaller maximums, and they have different ways that what they cover. So you have to kind of look at that, and it depends whether you've just had your latest checkup and you're pretty good, or you have a whole mouthful of problems, and then you're trying to figure out what the best payment is. So your situation is very important, and how it fits with plans is the next important part of it. Again, that's not me, but this is Double Health USA. I'm the CEO, and here's my personal email address, a corporate email address, and you can see a telephone number, local number, cell phone number, or a toll-free number. And if you call, you will get me, and I'll say, okay, let's get started and see what we need to do. So that's the approach that we have, and want to thank you for your time. And are there any questions about me before we go to the general questions? Yes.
So, are there fees involved?
No, we're set up just like Butler is set up. We're an independent agency, so we basically get paid if you purchase a product from an insurance company that we represent, which is most of them, and they're the ones who pay us for it. And the other point is that the fee, the premium you'll pay, and this is true for everybody, for all independent agents, is always the same as if you went direct. So if you decide to go direct, you want to do it yourself, you can do that, but the price will be the same. And if you do go direct, if you want to work with us, probably if you put us as your agent, then we're able to assist, or better yet, if you ever had a problem, then you have somebody else to go with. But the price is the same, regardless of whether you decide, regardless of what you decide to do. Any other questions? Okay, we'll turn it back to John. Thank you.
Okay, I was reminded, I'd like to thank the folks who are hanging with us on the webinar. Glad you were able to stay with us. I'll remind you again that the presentations that are given here are on our website. And relative to the question we just asked, to try to go online and research healthcare is very difficult. And what you'll find, what we've found too, is you don't necessarily get the best price that way because you just can't research it that well. So it's a no-brainer to use the consultants that we've recommended. That's our opinion, that's our experience. There's some good news out there on Part D drugs. The Congress in March pulled ahead the discount that was going to be while you're in the donut hole, that was going to occur in 2020. What that means is starting in 2019, if you're in the donut hole, the most you'll pay for a brand drug is 25%. So, and that's permanent. That's as low as it's going to go, though. That's what they meant when they want to get it down. And so it'll be 25%. I did prepare a one-pager that explains the changes in Part D between this year and next year. There's copies up on this table, and it goes through all 4 stages and helps you understand Part D. If you have an Advantage plan, you're still dealing with Part D, it's just that it's built into the Advantage plan, so the information is still relative. So before we adjourn, are there any general questions? Oh, I got a couple of questions. Go ahead.
Wait for the mic for the webinar vote.
You mentioned the change in the goal for 2019.
Right.
It used to be, I thought, and I guess I'm maybe mistaken, that the donut hole was supposed to go away in 2020.
Well, I thought that too, and with the help of the consultants who I asked to take a look at my writing, the goal was to get it down to 25%, so nobody ever had to pay more than 25%. So I was straightened out on that. 25% was the goal. When they say donut hole go away, they meant down to 25%.
Well, I have a general question that you may not want to answer, but got an Advantage plan. I got the information in the mail. My premium actually went down a smidgen, and the penalty for out-of-network essentially disappeared. Is there something else I should be looking for? It's almost too good to be true.
I noticed in the case of Part D, because I look at that all the time, that some of the deductibles that went from 400, the annual deductible went 400 to 300. Some rates went down. I think that every year they adjust based on experience, and my guess, unless someone's got a comment, my guess is it's based on their experience. They were able to make themselves more competitive by doing that.
Somebody to the mic and help us out.
Hi, this is just kind of a general answer because I'm not sure exactly what coverage you have, but if it helps, I think a lot, especially in Michigan, most of the Medicare Advantage programs, or quite a few of them, stayed pretty stable in price. There were a couple plans that actually had decreases from some insurance carriers, so it probably is not unexpected that you might have a little decrease, not a giant decrease, but in premium for a lot of plans. But again, I don't know specifically what you have, but it would not be unusual.
John, I have a question for you.
Okay.
I turned 65 in March, which means I need to be figuring this stuff out. Why should I go with double health care or Butler Capital Management or somebody else? Or do I do all 3 of them?
Well, if you want to, we tried to get it to a point where they all offer pretty much the same insurers, and of course the pricing would be the same. It almost comes down to just a personal preference. I wouldn't recommend any one of them over the other, but I definitely think you should be dealing with one of them because to do it yourself is very difficult.
I'm going to do it with one of them, but should I? I work your question. You can get quotes from 2 or 3 suppliers. So I get quotes from 2 or 3. Do it. You pick one and do it.
Oh no, it depends on your time, and of course their time too.
I'm going to be retired, so.
Well,
Ask each of them that.
just ask them. I mean,
Did you do more than one?
I went online and researched it myself when I wanted to change, and then I went through a consultant. Yeah, I used a consultant.
The difference between when you're at Chrysler and you're purchasing and doing an RFP is this, in this process. Number one, the price for all of them is zero. Right. Doesn't cost you anything out of pocket. So if you do an RFP, you get 0, 0, 0. Right. So it's not price. The price for the actual plans themselves, I believe, is all the same, whichever company it is.
Yeah.
So really, it all gets down to service. And whether in a personal relationship with each one of them. So I think your best bet is interviewing each one of them, looking at your individual needs, and seeing which one either face-to-face, if maybe you want a local company as opposed to someone in Ohio, or maybe that doesn't matter to you, or maybe they have a certain expertise because of a certain medical condition you have. That would be where I would look to try to differentiate.
Yeah.
I don't think that was clear before.
The one that you might want to venture into is looking at Part D. They will investigate, they'll take your list of drugs and investigate Part D for you as part of overall healthcare look. But on our website, I wrote a tutorial on how to go to Medicare.gov. You can do a lot of playing with what ifs. That's different than getting into Advantage plans and Medicare plans. But again, they will also help you with Part D. So you can do that. Some people like to, I do it. I go in there and I say, oh, you put your drugs in and then investigate yourself. Only because that's an easier site to use. Advantage plans are pretty complex.
I'm enrolled in the Delta Dental Plan.
But anyways, one of my personal experiences, and I won't mention which one it was, but I had a bill from a hospital that I had paid. It was over $1,000. And they sent a collection agency after me. No matter what I would do, they said I didn't pay it. Well, I turned it over to the consultant that I had, and they took care of it within 1 day. It was all straightened out.
Okay.
Well, I just want to give you an example that there's some things that you might have trouble accomplishing that these consultants have an inside track to how the business is done, and they can straighten things out. And you might not be able to do it.
Yeah, I mean, it's truly a no-brainer to use one of them. John?
Okay, I'm enrolled in the Delta Dental Plan, and I pay about $600 a year for that plan, and the max is $1,000. So basically, I'm buying $400 worth of insurance. Am I missing anything?
No.
Or is that it?
You'll find the majority of people are in the same situation. The time you do the math between what you pay and the co-pays. Now, I would tell you though, and I don't know which plans David offers, but the Guardian plan that Butler has is worth looking into, because if you don't use it, it carries over. It's got some, and it doesn't have a wait period. It's got some really good features to it. It's worth looking at. Now, I don't know, David, if you also have Guardian, do you? Okay, so they both offer Guardian. So Guardian Dental is one to take a look at, in my opinion.
Can I just add to that?
Yeah.
Okay, so when you say that it costs you $600 a year and you're getting $1,000 worth of reimbursement, and you're saying that nets out at about $400 that it costs you in addition, that is true, except for also you have to remember is that you're getting discounts for using the network. If you walked into a dental office and had your teeth cleaned, or you had to have an extraction, you might be looking at $2,000, $3,000 for that extraction. But if you use the Delta Dental, the Guardian Insurance, or anybody else's insurance out there, you're still going to get the discount. That service to you walking in the door without insurance could be $3,000. Then you walk in and you use the insurance, you're going to get it discounted down to probably $1,200, $1,500. Then the insurance is still going to pay $1,000 towards that. So it is true that you're paying a certain amount, you're only getting a certain amount of reimbursement, but you're missing out the part about you're getting a huge deduction for that network service. So that does count a lot towards what you're looking at. That's a big piece. And there are a lot of plans out there. I mean, we have the Guardian plan, there's a Delta Dental plan, And there are a few other ones out there, and we can, if you're interested in some different ones, we can look at, options. But we do represent the Guardian plan as a group plan, for all the retirees.
I think though you also need to check with your dentist to make sure they accept, not that you'd be changing dentists, but you want to verify that. That was an issue I ran into.
That's the question. If my dentist doesn't take. Please use the mic.
I'll ask you. If the dentist doesn't accept Guardian, can you do a direct payment? In other words, can I submit the bill to Guardian?
No, the Guardian plan has out of network.
You'd be out of network, right?
Right.
If you look at the, it's not up, I have it here on the sheet. We can pass, if you're interested, we've got sheets over here on the Guardian plan. But the way the Guardian plan is actually designed is it has in and out of network benefits. So if you were to go to the dentist and he says, yes, I'm in the network, they're going to take the reimbursement 100% in for your preventative, 50 for basic, and 50 for major, up to the $1,000. But we've also designed this plan that it has out-of-network benefits that are very similar. It's 100% preventative, 50 basic, and 50% major, up to the same $1,000. But it's reimbursed at the 90th percentile. Now, I would probably tell you that majority of the dentists take up to the 90th percentile, but there are some that will balance bill you for that extra 10%. So if the dentist doesn't take the insurance, you're only going to have a little bit of extra, that 10% that you could be balance billed for. If that dentist says he takes the insurance but won't bill the insurance company, then we can get you the form to send in to Guardian, and you can still try to bill the insurance company, yes. Yeah. But this plan is designed with in-network and out-of-network benefits very similar, other than the reimbursement schedule is just a little bit different. And that's true with a lot of plans. I know like some of the Delta dental plans that are out there, they have the same in-network and out-of-network. You just have to look at the three categories or the two categories of how it's going to be billed in and out of network. And the biggest thing you want to look at is if you have out-of-network benefits, how much is the UCR reimbursement to that dentist if you do fall out of the network area?
Well, you're throwing terms at us, so can I see if I can help that?
Sure.
Yeah. UCR equals usual, customary, and reasonable. Not 90th percentile means that it's got the if you have all of your dentists stacked up, you exclude the 10 highest paid dentists or something like that, the 10% highest, and you work with a 90th percentile charge, which will be could be less than what the dentist actually charged.
Right.
Those sound good? Mm-hmm. Ex-benefits guy. Always a benefits guy.
Okay, Jen.
As a former benefits guy, I always felt I could do better than these guys sitting over here, right?
Yeah.
So for years, I went through the process with my wife and my drug plan selection.
Yeah.
Then I heard about these guys and I said, gee, I think I'll give them a try. So what I did is I did it myself.
Yeah.
And then I had them do it. And voila, it was the same thing, same answer. So why should I do all the work when they'll do all the work for free? The other thing you have to be concerned about is I got my re-up from Cigna, and there's a tiny little premium increase for my drug plan, right? And you might say, that's great, I'll roll over and go back to sleep, right? Well, then I look at the drugs, and there's 6 of them. 2 of them are cheap generics, so set them aside. Out of the other 4, 2 of them went from tier up 1 tier, and the other one went up 2 tiers. So you can't be lulled in the complacency because you get a small increase in the premium. You need to look at the whole package, and that's what these guys will do. They'll look at all the drugs and they'll price them out for all the plans that you're eligible for where you live. So that can be a pain.
Yeah.
The other thing that's interesting is when you go into tier 4, you pay 35 or 40% of the cost of the drug, which sounds a little strange versus if you go, from what I understand, into the donut hole, you only pay 25%. Does that make any sense?
It doesn't, but that's because there's specialty drugs in tier 4. Yeah.
Right,
but you're better off in the donut hole on those drugs.
I just thought, what the heck's going on?
But you'll get there quick because of those drugs.
Well, they try to, every year they try to make it quicker.
Well, we adjourn to the specialists.
Anybody else?
Yeah, it's not a question, it's just something I read recently, and it's on the topic of medicines. There is a change in the legislation recently. The Trump administration announced that pharmacists are no longer
Yes.
under gag to not tell a customer which source for the drug is cheaper, so.
Yeah, in the past, if you went to the drugstore and there was a cheaper alternative, the druggist was not allowed to tell you. If you asked, they could tell you. What she's reminding us is that that's changed now. The druggist can tell you without being prompted.
I got another personal experience. This year, my cardiologist gave me a prescription for a drug, and I went to the drugstore. It was $470 for 90 days.
A little closer to your mouth.
It was $478 for 90 days. So I left and I said, no, I don't want it. I mean, it was a drug that I couldn't live without. And the nurse called me and told me about an independent drugstore. If I didn't use my insurance, I went there and it was $45 for 90 days. So needless to say, I haven't been using my insurance. I've been getting it for $45 for 90 days.
Yeah.
Just a personal experience. Now, the drugstore that I went to didn't tell me about anything like that, or whether it was available if I didn't use my insurance for a much cheaper rate.
Well, now they can. I don't know, they'll send you to another drugstore. I mentioned that on the website in the tutorial that one source is called GoodRx, and you could go there and check drug prices. I had one more thought. Another reason, I'll be quick, another reason to check your drugs every year is the drug companies will drop, or the insurers will drop certain drugs from their formulary. And if they drop that drug, they usually have to notify you, or they do notify you, but if you think you're fat, dumb, and happy, and then you got a brand drug they drop, and you don't get changed during this open period, there's thousands of dollars involved, and I've seen it happen, because more and more now they'll drop a brand drug from their formulary. You got to shift insurers, or you're going to be paying full price for it.
Or they'll elevate the tier.
Or the other game they play is they move it up on the tier. Another reason to check your drugs every year.
Now we can go down.
Okay, that's it. Thank you.
Hit the table.